A national health crisis has landed in Canada's capital, only a few steps away from Parliament. You can see it clearly in Lower Town, Ottawa.
Boss, you gotta get up. You gotta get up. The ambulance is coming, boss.
An entire neighborhood overrun by drugs, with one product reigning supreme: fentanyl. Fentanyl is an opioid prescribed for extreme cases of pain. The American Public Health Agency says it's 50 times stronger than heroin and 100 times stronger than morphine. It is also produced illegally on a large scale in China, then imported and sold at retail on the streets.
Hi, my name is Melvin. I reside in Sandy Hill, Ottawa, Canada.
When's the last time you used it?
This morning.
Melva and Sean are two regulars at this supervised injection center. They've experienced firsthand the devastating impacts of fentanyl.
A point of fentanyl is probably $10 and 10 points to a gram.
It's super easy. Like, a lot of people would not cross that barrier of actually using a needle. But, you know, they can smoke it and get just as high. The high is so overwhelming.
It was created for cancer. And these people are not cancer struck, So, of course, you're going to become nothingness.
Fentanyl, I overdosed on it twice. I've been using opioids for 20 years. I've never even come close to an overdose on anything.
You didn't see overdose in Ottawa until 5 years ago. You never heard about it.
But strangely enough, the biggest selling point is when they kill somebody, the drug. So word gets out on the street, try the purple fentanyl, because it's so strong it killed this guy. And people want to use that because they just want to escape.
The drug is easy to access, hyper-addictive, and above all, ultra-powerful. As a result, overdoses and emergency hospitalizations across the country have exploded.
This is actually where we have primary care and all of our examination rooms, as well as rapid access to medication.
Hi, Wendy.
What have we got here?
So this is a sample of suspected fentanyl that we wanted to get tested today.
This machine is new to the center. It tests drugs that were sold on the streets in just a few seconds.
This particular sample presented with 72% erythritol, which is a sugar, fentanyl 18%, and almost 10% bromazole, which is a benzodiazepine.
People don't know what is actually in the substance, nor the strength of what's in the substance. 18% is actually grossly elevated. And so subsequently, the likelihood of somebody overdosing on this particular sample is quite high.
Canadian police say a mere 2 milligrams of pure fentanyl, the equivalent of a few grains of salt, is enough to kill an average adult. Its effects are short-lived, less than crack or heroin, sending users into a race for their next fix, and police scrambling as crime goes up. Local police officer Paul Stam has seen downtown Ottawa descend into violence in just a few years.
The fentanyl situation has completely changed the game. The average numbers of property crimes that are happening over the last 6 years, so the average property crime rate is 300% higher than the city overall average. And the person-on-person crime, so assaults and those types of things, is several 100% higher in the downtown core. It really chews up our frontline resources really quickly, and we have very limited resources to begin with.
In Ottawa, as in most large Canadian cities, police no longer arrest users for possession of small quantities of drugs.
These are actually symptoms of much more complex underlying social issues like poverty, homelessness, mental health issues, addictions. So we need to address those complex, deeper-rooted issues if we're going to find long-term solutions, instead of just arresting people repeatedly and putting them back through the cycle of the criminal justice system.
Established in 2017, the Canadian Drugs and Substances Strategy prioritizes prevention and risk reduction among consumers while aiming to dismantle supply networks.
This is the historic market of Ottawa, back when the city and even Canada was founded. It's evolved now. Back then they sold things like fur or stuff to build houses, but now it's more of a traditional market.
Municipal councillor and downtown resident Stéphanie Plante believes the new public health strategy ultimately concentrates all services to a single neighborhood.
We have 3 injection sites. We have 4 shelters. and 3 day centers in approximately 3 square kilometers. That worries me because I have a lot of women who are victims of violence, human trafficking. If all the libraries, arenas, and swimming pools were only in my neighborhood, obviously the other councillors would be angry. We call this territorial equity. So I'd like to see services spread evenly across the city.
The local community association has questioned Ottawa City Hall for months. Authorities say there are currently no plans to increase the community services offered in Lower Town. They say help centers choose the place where they operate. According to the Ministry of Health, the opioid crisis has killed nearly 39,000 people since 2016, a number higher than all other accidental deaths combined in Canada.